Lifting, stretching, and pulling are typically mindless movements until you can't do them. A condition called adhesive capsulitis, commonly known as frozen shoulder, robs people of their range of motion.
When it begins, it usually causes pain with motion beyond a certain degree. So for the first period of frozen shoulder, any motion in any direction beyond a certain degree would cause limitation in motion and pain.
Signs and symptoms typically begin gradually, worsen over time, and then resolve, usually within 1 or 2 years.
Many times these individuals, when they're seen in the office, do not show any signs of arthritis of the shoulder. And so for someone who presents with these symptoms yet does not have arthritis, we look more towards frozen shoulder. Right?
Frozen shoulder follows a 3-stage cycle. The first is the painful stage, when range of motion becomes limited. The second is the frozen stage. It's less painful, but it's almost impossible to lift the arm. The third stage is the thawing stage. With proper treatment, the range of motion returns.
80 to 90% of the time, frozen shoulder is treated with physical therapy. When physical therapy and strengthening exercises fail to improve the function, we then move on to certain procedures. The least invasive, which would be a manipulation under anesthesia, where a patient would be put to sleep and the shoulder actually mobilized.
Risk of getting frozen shoulder increases after an injury or a stroke. Diabetics are also more prone. A long and painful process, there are ways to melt even the deepest freeze. For Lee Memorial Health System, I'm Amy Osher.